Time now for our weekly review of the latest COVID-19 data in South Africa, as well as an update on the vaccine rollout with Malan, Editor-in-Chief and Executive Director of Bhekisisa, the Centre for Health Journalism. Mia, good to speak to you once again. The family meeting is imminent. How do you see it unfolding?
Yes, I think we can certainly expect some measures being introduced. What we really need to look at the moment is, because we're approaching a third wave, just like with the other waves, we would like to slow down the infections or spread them out over a longer period of time. And obviously hard lockdowns is not an option because of the economic implications. So the two other things that we can do is to specifically look at reducing the number of the size of indoor gatherings, because we know that the virus spreads so much quicker indoors than outdoors. So we're likely to see the government announce that we will now not be able to be 250 people as currently inside gathering. It should be smaller. And we also likely to see curfews, I think, because curfews is a way to reduce the amount of time that people have to indoors in large groups. The other thing that we can do is to make it, to encourage people to do more mask wearing and do social distancing. And ways to do that, the one is enforcement, police enforcement, but that doesn't really work so well unless it's widely reported in the media and it's public. It's very impractical for one police person to run after many people not wearing their masks. So generally what works there, according to the experts that I've spoken, is to increase a lockdown level formally, so that sends an official message that things are now worse and that there will be measures that you need to adhere to.
Now, obviously, we've seen an increase in the numbers. Is this all a case of fatigue around COVID? Is it COVID fatigue? Is that what we're seeing? Is that what is causing these rising numbers?
Well, I think there are various things responsible for it. Certainly people, being less adherent to mask-wearing measures is one of them. But what we have indeed seen is a consistent increase over the past 3 weeks, and that is what we should be concerned about. And also, if we look at the proportion of positive tests now for the past 7 days, that has increased the 10% mark now. So it means more than 10% of the tests that we do come out positive. And that's an important measurement, because the World Health Organization regards if you pass 10% as a resurgence in infections. So we're definitely moving towards that. We know in 4 provinces those infections are increasing the fastest at the moment. We know in the Northern Cape and in the Free State and Northwest and also Gauteng are the 4 provinces that we really need to watch at the moment. And important to know that in the past, say, 4 or 5 days, the number of new COVID cases each day has been consistently over 4,000. Important to know that those cases at the moment are likely much higher, because it takes 10 to 4 days for a positive case to show up on a test. So we generally have figures that are the figures that we're looking at now were the infections of about 2 weeks ago. So we're likely already into a higher bracket of infections.
So are we reacting too late then with these proposed changes or firmer restrictions if they do come into effect tonight?
Hard to tell. I have spoken to some experts that thought that we should have started, a week ago already with measures so that we prevent South Africa from going into 5,000 and plus infections a day, and that if you wanted to prevent that, they needed to just start, 2 weeks ago already. But not all experts agree on sort of what measures need to be implemented. Also, I think the president had to first meet with, the Command Council and the Ministerial Advisory Committee, get advice from them. And all those things take time.
Now, there are talks that there probably could be oxygen shortages ahead of the third wave. Again, is this a case of us not reacting quick enough?
That's a hard thing to answer. I think that all we really can do is to try in each province to prepare our hospitals, to look at oxygen. There is some oxygen being produced locally, a lot of it at the moment. The most important thing at the moment is perhaps to distribute that oxygen correctly and to have good measurements as to where you need that oxygen.
Now, when we look at countries, certainly in the in the developed part of the world, you look at America, you look at the UK, many of those countries, for life is returning to normal. And that's because they've been vaccinating everyone pretty quickly. Now, during the last week report, South Africa averaged 22,500 doses administered each day. And it is suggested that at that rate, it will take a further 519 doses to vaccinate 10% of the population. This is just not good enough, is it?
Sorry, Yes, you cut out now, so I didn't hear your entire question. But I did hear that you were talking about the vaccine rollout and the fact that countries like the UK and the US have vaccinated far more people than us. So if we look at the progress in South Africa, on the upside, we have more than double the number of people that we vaccinated this week compared to last week. Last week, the average number of people that we vaccinated per day was about 24,000. Now it's more than 60,000 a day. So that's good news. I think the biggest challenge we're facing at the moment is that we do not have J&J vaccines. So the government set a target for this past week that we should have vaccinated 109,000 people a day. We were doing, just more than half of that, but it's against the background of the J&J vaccines that we don't have yet, and that we really have no control over when they will get released, because it all depends on an FDA investigation that needs to be concluded. And the interesting thing is that investigation affects 60 million J&J doses around the world. We only have 1.1 million that's going to be released now if that go-ahead comes. So it's not just us, but it definitely puts us behind on our targets. And it would have been interesting to see how many people, if we would have reached that 109,000 target, if we had the J&J vaccines. So all we can hope for now is for those vaccines to become available as quickly as possible. There's been glitches with the EBDS registration system, but I do think those are being addressed. And I don't think that's our biggest challenge. Our biggest challenge is the supply of vaccines.
I get the impression that somebody's dropped the ball and all we're doing is making excuses. I mean, we look at Zimbabwe a few days ago. They had vaccinated 500,000 people, which is a little more than we've vaccinated.
It's important to remember that we have a variant that is dominant here in South Africa, the 501YV2 variant, that restricts which vaccines we can use. We can really only use vaccines that we have data for that tells us whether these vaccines work against the variant in South Africa. Many other countries don't have that challenge. If you look at Zimbabwe, they use Sinopharm, for which there's not data about the variant at the moment. So the two vaccines that we are able to use, J&J and Pfizer, for which we do have data, just happened to be that the J&J vaccine, as you know, was paused a month ago because of side effects that was investigated, and now there's a verification process. So I don't think it's fair to say that Zimbabwe is necessarily just moving faster than us because they're more committed. We really do have fewer vaccines to choose from, and we have had unfortunate events. That does not mean that we shouldn't be putting in an effort and shouldn't be putting pressure on the government to work as fast as possible. And I think the one thing that we really can be unhappy about for the health department is the communication around the vaccination campaign. I've seen so many people being confused about, do you qualify for a vaccine? Will you be prioritized if you have a comorbidity? And you won't, but that has never been communicated properly by the health department. I don't understand why they haven't had a public session on television stations on the EBDS to explain to people what to do if you don't get an SMS, or what to do if you have been assigned a site that's too far from your home. And I think those things often cause us to hold the government responsible for things that they're not always responsible for, but are working towards. It doesn't mean I'm saying they're doing everything right. They're not. But there are things that they're doing right that, because they communicate so badly around it, for instance, the J&J vaccines, people even hold them responsible for that.
Yeah, help me understand this. When COVID-19 hit our shores, there was a particular variant. That variant then developed or mutated into something else. Does this mean that the initial variant is no longer present in South Africa and that it's just the new variant that is now present?
So the new variant is definitely dominant in South Africa, and dominant means it's in most of the cases. The last figure that I saw was that 95% of COVID cases in South Africa is caused by the new variant. And the reason for that is because viruses mutate so that they can survive better. So those mutations that they get are all geared towards, for instance, spreading faster so that they can make more copies of themselves, and also being able to escape immunity. So in other words, to make vaccines work less well, but also for to be able to fight against the antibodies we form in our bodies. So because the variant that we've identified in South Africa has so many mutations, and so many mutations of significance, particularly with regards to escaping immunity, that variant is now dominant. So if you wanted to compare how much of the original variant is left, you know, most of the cases is caused by the new variant. And interestingly, because of the kind of mutations and the number of mutations that this variant has, most experts agree that the variant from India that is now also in South Africa and the variant from the UK will not overtake this variant, because this one has more sort of mutations that can make it survive better than the other two.
Now, one of the biggest fears when the elderly were getting vaccinated is side effects. Have any been reported? Is that something that the government is monitoring closely?
So the government is monitoring that closely. There is a system in place. You know, there's a SAPRA, for instance, has an app in which you can report side effects, and it's definitely also followed up. But we have not heard any announcements on it. But having said that, it's only been 2 weeks of Pfizer vaccinations. However, I was at the Discovery Health Vaccination Center in Sandton last week, and they have not had a single case of a severe allergic reaction or someone, reporting any incidents of blood clots, for instance. So far, we don't have figures with regards to side effects in South Africa, but I can say that side effects are very rare. Mild side effects are common, and mild side effects are things like, you know, having a bit of pain of where you were injected, or your skin maybe having a little bit of rash. But severe side effects such as severe allergic reactions, and in the case of the J&J vaccine, which we aren't using at the moment, very rare form of blood clots, is really very rare. To give you an indication, in the case of the J&J vaccine, when it comes to blood clots, your risk, the general population's risk with the figures we have at the moment, is about 1 out of 1 million to develop a blood clot. It's a little bit higher for certain parts of the population, women between 19 and 50, and that is between 5 and 7 out of 1 million. If you have COVID, your risk of developing a blood clot is about 10 times higher. So if you have to choose between having a vaccine and having COVID, you would certainly want to choose a vaccine rather, and we have very good systems in place at the moment with regards to screening people for blood clots and monitoring them afterwards.
Malan, thank you so much for your time this afternoon. Appreciate it.